Naturopathic doctor, Dr. Jacqui Fleury joins us now with today's Healthy Living. Good morning, Jacqui.
Good morning, Chantel.
Good morning. And we're talking about menopause today, but for males. So my first question, do males go through menopause?
Well, they do in a similar fashion as women do. So we often hear a lot about menopause, and for men, it's actually called andropause. And the difference between what a man will experience and a woman is that in a woman, her hormones shut down completely. Her ovaries stop producing estrogen and progesterone. And in men, their testosterone drops gradually over time. So starting in their 40s, they start to notice a slow decline, about 1% per year. And it can actually be a bit more drastic than that if they're carrying a little extra weight or don't have a lot of muscle mass or on certain medications. So there are definitely signs and symptoms that a man might be approaching andropause. And sometimes it can just catch them right off guard. So they might be feeling low energy, they might notice a decline in their muscle mass, their moods may shift, their libido may drop, they may not sleep as well, they may feel a little bit lethargic or depressed. So it's more of a gradual decline for men.
Okay, so how could we support a male going through this as they age?
Well, definitely we would want to be proactive, just like we are for women, and starting in their 40s, making sure that they're maintaining exercise, managing their body composition, eating well, watching alcohol, getting good sleep, those sorts of things. Once they hit their 50s, they may notice a drastic change in their energy, their libido, their sleep, their moods. And at that point, maybe having their testosterone checked through some blood work would be a good place to start. Also having other hormones checked, like their thyroid. And then in terms of strategies to support them, we could certainly improve their lifestyle, their nutrition, their exercise. And sometimes men just feel better when they take some testosterone, so that's worth talking to their doctor about.
Okay, so dietary changes. What sorts of foods and then even supplements could help minimize?
So zinc is a really important supplement because it helps with the production of testosterone, and it's also really good for their prostate. Essential fatty acids, omega-3 fatty acids are really good. Vitamin D is important for the production of testosterone. And anti-inflammatory herbs and supplements, things or anything that's really colorful. So blueberries, peppers, any really colorful food is going to have high antioxidants, which is also really helpful for the production of testosterone. So there's lots we can do from diet and lifestyle perspective. And like I said, some men sometimes need a little extra support from the help of their doctor, maybe getting their testosterone checked to see if it really is quite low.
Okay, and also the importance of exercise and maintaining, maybe building that muscle mass?
Absolutely, absolutely. So the more muscle mass there is, oftentimes that's directly correlated with the level of testosterone that they're producing. So, you know, if we think about the things that help women when they're going through menopause, a lot of those similar lifestyle changes are very helpful for the man as well.
Okay, Jacqui, is there anything else you would like to add about this?
Well, I think that the one thing to note is that sometimes we're so focused on women and their time of life when they're going through all these changes, but for the man to make sure that he is being really proactive and taking care of his hormone health too while he still has some healthy production.
Wonderful. Dr. Jacqui Fleury this morning with Healthy Living. Thank you so much.
Thank you.
Thank you.